Yundu Yalanda, and that's from my language, from the Cook Yalanji people, and I too acknowledge that I'm on Aboriginal land, the land of the Jagera people today. The session that we're going to be delivering to you today, Amanda and we've worked closely together, so it's like we're competing siblings at times. So we're going to be working back and forward together on this presentation, and we've got a presentation that you'll be able to see on screen as well. So acknowledging the different lands that we're all upon across the country and our elders past and present.
All right.
Thank you. So the ethos that we work under, and there's a saying that's used, a child not embraced by the village will burn it down to feel its warmth. And it's our firm belief that there's something transformative that happens to survivors when they access justice, making for what happened to them as a child. And that this is a human right and should be available to everyone, regardless of life paths, circumstances. And we also see the cost for everyone when this justice is denied. So we know the impact fairly well. Amanda.
Thanks, Gary. Can I just really quickly say I am absolutely thrilled to see Chris Lee on screen, and I just wanted to say a hello to Chris. Chris was the very first Aboriginal engagement advisor that I had the deep honour of working with at Knowmore in the Brisbane office, and has gone on to do amazing things. So I just want to say a quick hello to Chris. So a little thing about Knowmore, as Louise introduced as well. We are a free community legal service. We were set up in 2013 to run alongside the Royal Commission into institutional responses to child sexual abuse. That was supposed to be a time-limited piece of work, and it was quite groundbreaking at the time. It was a multidisciplinary, trauma-informed legal service to support survivors to come forward and share their experiences. Then there were, as a consequence of Royal Commission recommendations, a National Redress scheme was announced in for 2018 to start. And so Knowmore was asked to continue on. And since that time, I think it's ended up about 3 or 4 times the size. So it's a service that now has about 180, 190 staff nationally. It's absolutely in the thick of delivering services at the moment for the National Redress Scheme, which is for institutional child sexual abuse survivors. But also we very proudly support survivors of the Territory Stolen Generation Scheme, and Gary has led the way in that work, and also the WA Stolen Generation Scheme. And, I'm having the great honour of being on Noongar Budja country today. I've also had a hand in helping us stand that up alongside Gary as well. Just for context, when we talk about the spread of the service, since it started, there's been more than 160,000 calls to our 1-800 line. And we've assisted more than 30,000 individuals in that time as well. As I said before, it's a multidisciplinary model. So as well as lawyers, we have Aboriginal engagement advisors, we have social workers and counsellors. We have financial counsellors. They include law reform and advocacy in this diagram, and I'm not going to argue the point except to say that that's a piece of work that we do, but it's probably not part of the direct wraparound service for survivors. But it's a really integrated model, and was probably the first of its kind in Australia at that time. There's sort of been quite adapted and adopted since. I guess it was in recognition of the fact that asking people to navigate legal spaces is often re-triggering, re-traumatizing, and difficult to do. Gary.
So that's just a blurb about what my interest in is. As a First Nations person, as an Aboriginal person, we've got many levels of interest, but I've crafted a career around human rights and justice issues, and participated in many boards as we go. I'm a current board member for the Indigenous Peoples Organisation of Australia, and we do work around presentations for the UN, and some of the projects are run through the Human Rights Law Centre as well. But previously, I've had a number of board positions that also form the experience, but the expertise that I now have and share with Knowmore Legal Service. So we know that Aboriginal and Torres Strait Islander people remain the most incarcerated people in Australia and amongst the world as well. We know publicly, and there are policies and reforms like the National Close the Gap strategy, and incarceration rates have continued to rise. Target number 10, there's been a failure in that, and we're asking government to do more. As of 2025, there's 17,000 Indigenous people that are imprisoned across the country, making up about 35 to 37% of the prison population. And that's despite us only being 3 to 4% of the general population in Australia. And that comes from the ABS. The ongoing overrepresentation highlights systemic inequalities with the Australian justice system and signals a failure of national policy commitments. Access to justice, making about child abuse and removal as a human right, and half of the people in prison, Knowmore supports, identify as First Nations people, compared with 37% of that population. So 50% of our client group are First Nations people in the work that we do across prisons.
We wanted to just share some general information. This is publicly available. What we will say is that the Department of Social Services, who run the National Redress Scheme, and I guess this is why we've probably chosen as the sort of other major national service in this space to try to do a bit more to be public with the data that we hold, is we had hoped perhaps that there would be a little bit more that would come from a transparency and data sharing space from the scheme, because it's an invaluable piece of information and resources that could come from it, but that hasn't necessarily been forthcoming. So sometimes they're quite protective of their information, but we can share these because they were reported, I think, through the Joint Select Committee. So
Right.
we know that as of December 2025, there's almost 73,000 national redress applications that have been submitted, and of those, people that identified as being in prison at the time of application were about 3,700 of those. What's worth noting is that the Royal Commission, when they projected figures for the life of the scheme, which still has about another 15 months to go before applications close off, and then another 2.5 years until they are processed. But they said that they thought 60,000 people would come forward. They also thought that people would come forward at the start of the scheme and then that would taper off. And we've seen an absolute reverse of that. There is an absolute tsunami of people coming forward, and some of our data will show that that's particularly relevant for people in prisons across Australia. So you can see there we're looking at about sort of 3,700 applications from prison. The other thing that's probably just worth noting, and I know that Gary speaks to this as well, but is just that the opportunity for people in prison not just to apply, but to be able to put a decent application together is really, really limited. And so we anticipate that there will be a lot of people who, whilst having submitted an application, may still struggle to get their application properly assessed as well, because of those difficulties. So I want to just talk quickly about some of the work that Knowmore has done with people in prison. We've always worked with people in prison. And again, I'll shout out to Chris because I can remember being back in the trenches for Queensland in particular in the Royal Commission days. But we ended up with, by the time the Royal Commission work ended, there was about 19% of every single client that Knowmore supported had been in prison. Were in prison at the time that we worked with them. We found that since the redress scheme started, so there were some pretty, disappointingly, some fairly stringent restrictions placed on people applying in prison in the original setup for the National Redress Scheme. So if you had a head sentence of 5 years or more, then you had to apply under special circumstances, and that usually included the respective attorneys general speaking to one another and deciding whether an application could go ahead, or other special circumstances. So if you were, perhaps at the end of your life or unlikely to exit prison for the whole life of the scheme. But it was so people in prison was always finding their way to us, but it was a very difficult pathway for them often to apply. There was, I won't get into too much detail, but this notion of anything that could bring the scheme into disrepute. So the implication being if you had committed particular types of offences, so child sex offences, other sort of serious crimes, that there was quite often a kind of a dimly held view around perhaps a person's right then to particularly financial compensation through the scheme. Um, in 2024, there was legislative changes. They came out of recommendations from the 2-year review, which took 6 years, I think, Gary, to actually land. But
Yeah, to act.
we move slowly in government. But in 2024, the legislative changes applied, and what that meant was that prisoners were then allowed to apply directly without exceptional circumstances. There was a refined assessment for serious criminal convictions. And then also DSS's own operational guidelines were updated so that they were able to support access for incarcerated applicants. What we've seen since then is an absolute deluge of people in prison applying. What that's meant for us is, and we've got data to show that as well, I think roughly now, isn't that right, Gary? About half of who we support currently or Knowmore supports currently are now in prison. That's about 600 active clients as of today, is my understanding. We're also in over nine, I should say too, we're in over 90 different correctional centres in Australia. So we think we've pretty much got the largest reach of any legal service nationally. And yeah, it's pretty daunting when you look at the size of it. Because of that, what we chose to do was we had to start thinking a bit differently about how we were going to do this work. And so what we stood up was the prisons coordination team. Had the great honour of getting a chance to help us build or Knowmore build that. Got to stop saying us. It takes a minute. And so what we wanted to do was create a team that had some specialisation and practice expertise. It's a multidisciplinary team. They keep clear oversight of all of the referrals coming in, can live track exactly where people are up to in the system. Have they had an appointment yet or not? How long have they waited? Where their application is up to. So because it's too easy to lose people in these systems. The other thing, as well as tracking, so data tracking has become really critical for that work, and I guess that's why we've really been able to get some more information sort of together in this space. We also chose to pilot specific responses. So we found, for example, women in prisons had quite different help-seeking behaviours, and so we chose to directly target a couple of women's prisons and work directly with them, and so go in and run legal clinics and follow up with, individual appointments and things. So we've tried to do things a little bit differently dependent on demand. The team also needs to work closely with the different jurisdictional arrangements. We've found that each of the states and territories, as you will all well know from your interest in this, everyone has different rules. They all, even that can change depending on the correctional facility you're on, if it's a private or privately run or public one. This is a lot of the work that Gary really helps us lead on because of his strategic engagement work. So just building those relationships with attorneys general and corrective services and things, and making sure that they understand why this group of Bolshe lawyers and social workers and Aboriginal engagement advisors suddenly want to rock up to their prison as well. So yeah, over to you, Gary.
So we've got some slides just on some of our data, but you can see by those slides where we've had an increase of clients that have been detained, clients that are in prison. So, 2023, we started to see the number rise. 2024, where people were just getting used to being able to apply direct or with our support as well. And 2025, it actually shows it's at a 50-50 level. There's an equal split of clients that aren't in detention and clients that are in detention. So we have a look at some of the prisons that we've worked across. And there's 113 prisons across the country, and we're in 90 of them. But these are the top 10 centres by client volume. And the top one is actually a privately run prison. So we found it interesting that we had better access and a greater opportunity to get the first lot of information through at Acacia Prison in WA. But you can see the complexity of it across some of those states, and we're still to crack the ceiling in New South Wales to give us greater access there, but we're in those spaces and we haven't got the large number of clients that come through there as well. So you can see there out of the note, there's a percentage of the applications that are done and completed as well. But by client volume, South Australia is leading the way, and that's where we done also the pilot for the women's prison in South Australia. But that's just a number of the prisons that we know that we have got a large client volume in this so far this year. And there's only been a few months that we're collecting this data so far, but that's the top 10 there. So here it paints a picture of the clients in detention that identify as First Nations. So we can see the increase there. The light blue colour is actually First Nations, Aboriginal and Torres Strait Islander, and you can see the increase in 2025. So it stagnated in 2024 when people were awaiting the amendments to come through. 2025, we actually saw our teams actually making a difference in the service delivery model that we set up to work in prisons that it enabled more First Nations people to engage. So it's interesting because in some prisons we get access to the First Nations people first up, and then others will follow from there. So this is by
Oh, sorry, Gary.
This is by state, so you can see by state, and you can see that Queensland has the largest amount there. But we've even got some international clients, and there's a small number of clients that you'll see in the ACT as well. But so Queensland followed by New South Wales. NT is very, very low. It shows on this, but WA is up there as well, and WA is forever increasing in this space.
You happy for me to jump in now, Gary?
Yes, happy for you to jump in.
Great,
Yep.
thanks. Yeah, we just really wanted to highlight the continued overrepresentation. WA is always batted above its weight for our client numbers more broadly. And that's definitely replicated in the in those prison numbers there too. And as Gary said, Queensland is still leading the way to some extent there. So a lot of these are little thin lines on charts that are maybe hard to see, and we're happy to provide a copy of our slides if anyone's interested. We'll send those through to Sarah. But what we wanted to really highlight with this is that, and it won't be apparent on here because trying to compare it with our general data was just going to make it too messy. But what we can say is that this is for people in prison, they are younger than the general cohort of people that Knowmore supports. Because of the terms of reference for an eligibility criteria for the National Redress Scheme in particular, and also for stolen generation schemes, you should anticipate that people are going to be in an older age group category. But we have found that for people coming to us from prison, they are often, quite a bit younger than our general sort of population of people. You can see there that they really max out in that 46 to 65 and then drop right off. With gender, we've found, not unexpectedly, it's, there's far more men that we support in prison than women, but the numbers of women are going up. We see that correlates as well with general data around women in incarceration across Australia, particularly Aboriginal and Torres Strait Islander women. We've also found that since we've had those targeted strategies of working more directly with with women's prisons in different jurisdictions, that's really helped us with our engagement. One of the things, I guess, that we found with women and again, the Royal Commission found this too in their private session summaries as well, women were more likely to have had multiple offenders. They were more likely to have been offended in both intrafamilial or community settings and then also institutional settings. And then to also go on, I guess, to live a life of often polyvictimization. So by that, going into experiences of domestic and family violence, adult sexual violence, and different trajectories as well. And so we've found that we've needed, not to say that men don't also face significant challenges as they navigate their life out of their childhood experiences, but we have found that often it's a different way that sometimes women might need to process or access justice making about one particular type of childhood trauma when you're often still, living in it or living in the consequences of it. So we found that targeting of how we work with women has been important for how we land a better response for supporting people in prisons. Again, this is just some information. So we get people to self-report. We're not in the business of assessing people or anything like that. But anyone that comes to Knowmore, we will ask some questions that include questions about disability. So, for example, 53% of who comes to Knowmore broadly tell us that they have a disability of some kind. Typically, they are, as you would expect, they are mental health related. They include, anxiety, depression, PTSD, other factors often associated with complex trauma. Sometimes they are more complex or, diagnoses, bipolar disorder, borderline personality disorder, schizophrenia. For the people that we've supported in prisons, you can see here that we get quite a number of people who report around mental health generally, PTSD, anxiety, depression, but also, physical disability as well. So not dissimilar to the general population. What we have found is, and that'll come up again at the end, but it's just uh, people in our experience, and I know when we met with Professor Kinner, he very firmly pushed back on uh, our anecdotal assessment, but we find that the people we work with can usually rattle off what they've been diagnosed with or told they've got in prison, but they don't often, no one's sort of screened them for much else or kind of followed back up on what that sort of might mean. This slide here is, I think, is telling. What we've got here is the different types of institution reported as where abuse occurred. For people in detention, you can see that against people not in detention. So out of home care, not surprisingly, is pretty terrible across both cohorts. But what we notice for people in detention, and this is a story that we heard time and time again from people during Royal Commission and now also into Redress, is that those that were offended against in youth detention were often the people that, so abuse had happened early in their life for whatever reason that had led to them getting into some difficulties in life, and then they found themselves in youth detention. Their experiences in youth detention were often brutal and life-changing. Gary, what's the stat on, I think, was it the Royal Commission said 28% reported being abused by youth detention staff? Is that right?
Oh, that's correct. Yep.
Yeah.
And we've found in one location with adult offenders that are incarcerated, that some of the people that hold the keys were at the juvenile detention centre when they were
Mm.
were in youth detention, and now they're in adult prison with the same perpetrator as a key holder. Yeah.
Yeah. So it's not hard to think about what the implications are for how on earth do you ever even feel safe in the first place while you're in prison to come forward and talk about what's happened to you, much less know that someone that has offended against you is watching and listening. So, these are the environments that we also have to operate in. Sometimes physical safety as well as psychological safety are hugely challenging in terms of how that's navigated, especially when you're talking about, 1 yard phone for people to dial up and legal appointments occur. We have privacy around those, but even then, there's not enough appointments for people that want them. And, we won't have a chance to kind of dwell on this, but just even the lack of, meaningful trauma-informed care, like can anyone get
Mm.
access to debriefing or other things that they might need after an appointment like that, their lack of privacy. So coming back just to this slide, and because it's going to come up again in a minute in what the Royal Commission also found in contrast. So this trajectory of abuse, either, out of home care, and then young people that ended up in juvenile detention, were more likely, in our experience, both anecdotally and from what our data tells us, to end up then kind of remaining in the prison system. And I'm sure we're
Listen.
talking to a room full of experts here on all of that, but just to say that's what our numbers showed as well. So just really wanted to look at what did the Royal Commission find. When you go looking for information, there's still not a lot of it about about child sexual abuse and people in prison, or if there is, we'd love to have that sort of sent our way. But what the Royal Commission certainly found was back in 2017 in their findings. So but when they did private sessions, so I think there was about just under 8,000 private sessions that occurred, but there was about 10.4% of those were in adult prison at the time of their session. Most were male, and you can see they're very similar. So abuse in out of home care, but also youth detention, and that data on abuse by custodial staff as well. So we are seeing a similar kind of pattern in what's coming through. And that's just that slide again, just for reference. Okay, Gary, over to you.
So, what's needed? We know the lack of trauma screening and trauma-informed care occurs in prison, and it's been our experience that intake screening is mostly routine, including mental health and suicide harm at risk. However, trauma screening is not consistent, and it's not consistently implemented across Australian prisons. There's a high prevalence of mental health conditions and distress which suggests widespread trauma exposure. An ongoing or repeated trauma assessment is usually only done if a prisoner requests support or is identified at risk. So there's little or no access to support that could treat trauma symptoms, which is particularly challenging when people are unpacking child abuse in a prison environment. So we were told in one of the jurisdictions that there's one social worker per 1,000 inmates. So what's the opportunity for people to unpack some of their trauma even after they've had sessions with us? So there's no national prison-specific child sexual abuse data sets, and it's important that we do have this because we're going to have another tranche of another generation that will come forward where their abuse has happened after the eligibility date set by the Royal Commission. So Australian doesn't have a current collective or published official national statistics specifically on the prevalence of child sexual abuse and the histories among people in prison. There's no ABS, there's no health release or measures this population or compares directly to the general community. And this means we don't have a nationally representative number of how many prisoners experience childhood sexual abuse, with the exception of the data that we're collecting. This gap's been noted in academic and justice research and national crime statistics focused mainly on offences. So we know why people are locked up, but we don't know the reason or the pathway that led them to that as well. And it's not their lived experience or their histories that is considered. So in closing, Knowmore currently has the single largest national reach of any legal service into prisons across Australia as a collective. We're represented in every state with the exception of Tasmania, where we do outreach. We've got over 180 staff across a number of disciplines. The rates of childhood trauma associated with institutional abuse show a clear pattern of later incarceration and recidivism. So it shows that, it indicates that. Young children and young people abused in youth detention facilities continue to be overrepresented, and who comes forward seeking assistance for child sexual assault? We actually have younger people, which I was amazed that we do have younger people that now phone us, and we have to do a referral pathway for them as well. So this is particularly alarming at the current jurisdictional policy environment as well, especially when we look at the age that people can lock up a child at 10. So the lack of a trauma screening and lack of support for trauma treatment, trauma-informed care, combined with physical surroundings, make recovery from child sexual assault more challenging than for the general population. And that's known when people are incarcerated. A lack of research also compounds this. And First Nations people are overrepresented, not just in the prison population, but in those who also have experienced child sexual assault and or removal. Last year, the number of Aboriginal kids in care around the country hit the number of 24,000. We know that people in prison continue to be contentious in some government and social policy environments about their rights to access justice for what happened to them as a child. This has direct implications not only for individual recovery, but also for opportunities to reduce risk factors associated with offending and recidivism. People in prison have a human right to access justice making for childhood harm and abuse. So that brings us to any questions, if there's any questions from the crowd.
Thank you so much, Amanda and Gary. That was a fabulous presentation, really interesting and really inspiring. And I'm sure there'll be lots of interesting questions. If you've got a question, please feel free to raise your hand in the chat, or if I don't see you, you can just also give me a shout out. But I just might kick it off with a question, if I might. You mentioned that there's a real need for more research in this area, and there's a lot of people involved in research on this webinar. So I wondered, could you point to what sort of things do you see as the real priorities for research that would assist the work that you're doing and the people that you're supporting?
I think research, Gary, happy for you to jump in any time as well. I think just the research around making the connections more broadly to experiences of child sexual abuse, and then I guess particularly the longitudinal effects for people, the rates of recidivism would be one sort of area that would be of interest. We're very aware that the clock is ticking, and so no more's not going to exist in this space because the schemes will start to wind down shortly. So we want to really make sure that that those experiences aren't lost. Also, too, because it needs to feed into contemporary advocacy. I mean, adult crime, adult time, palavers in jurisdictions are horrifying when you see, what the data tells us about what happens to people, young people, when you put them in juvenile detention. And the rates that are probably in there that aren't spoken about either are the child-on-child offending. And so, it's not just a simple matter of saying, oh, well, staff are better trained these days, or that wouldn't, it's not just about the staff, it's also about the other things that occur in those spaces that are complex and challenging too.
We've got a data set around the stolen generation. So the Healing Foundation's done some really good work about the impact of the stolen generation, but we need to have that data set for people that are incarcerated as well, because the trajectory of life, we want to make sure that government can see that, but we also may need to put a financial lens on that so government can see that there'd be cost savings in some form.
Yeah, thank you. So a few people have mentioned that they'd love to get a copy of the slides. So just to confirm that Amanda and Gary have kindly agreed to share the slides, and that they'll be going to Sarah so we can get you those slides. Chris Lee has put a question in the chat. He's asked, what's the success rate and average length of time for redress applications?
Good question, Chris.
Yeah.
Hello. Success rate, not really sure on, because DSS tend to keep that a bit sort of close to their chest. But the current wait times at the moment are blowing well out over 2 years for getting applications processed. We have certainly seen, and our team has been very vocal on this and has spoken about it at, the Knowmore's team, to Joint Select Committee things. And Gary, you probably are more across this than me, but particularly concerned around what we've seen is a lot of churn through the independent decision maker process. So there's the ways in which legislative decision making has been applied over time has become a lot more stringent on people. We believe very firmly that you should expect the same outcome and the same level of service and support if you signed up on day one as if you signed up at year 9. So that I think the scheme is aware of that, but yeah, it's gotten they're getting a lot more pickier. They're getting a lot more fussy about who they're saying yes to, and it's taking a lot longer. And as we all know, that doesn't help survivors feel confidence in a justice making process. So if you've got a chance to get on a soapbox anywhere, anyone, take that up. Yeah.
Jump on it, yeah. Or if you get a chance to become an independent decision maker in some form, we need the
run for the
social
hills, don't
side
do
of
that.
us
No,
to
poison
be
shells.
there. Yeah.
Right. Now, I'd like to invite anyone to ask a question. You can either put it into the chat if you prefer, or you can ask it, you can unmute yourself and ask it aloud. I can't necessarily see hands, but just...
I have a question, Louise.
Yep.
Sorry.
Great. Thanks, Amanda.
Sorry, Stuart, I've jumped in front of you. Thank you, Amanda, and thank you, Gary. I have to say that's a very depressing presentation. And I mean, when you think about some of that data, and it's actually so some of this is really current. I mean, you're not even looking deep into the past. So is it fair to say, is the rates of assault in youth justice and out-of-home care occurring in like the last number of years? And excuse my bad eyesight, I couldn't really read. I'm on a laptop screen, so I was trying to see what time frame are you talking about, and is what you're seeing still occurring?
Thank you. So we work with people that fit within terms of reference for the schemes that they apply for. So these are historical matters. But I think, and Gary, you probably can talk to this more than me, but as far as we know, there doesn't seem to be an improvement that's occurring for children and young people. The biggest predictor of what will happen in the future is what's happened in the past. And this is something that survivors tell us all the time. But the single biggest reason that they come forward is to help other children. So we know that without significant sort of policy change and practice changes, things aren't going to look a lot different. And that's again, our concern and our advocacy. What we're really trying to do is connect what we know from historical experience into what's also important and needed for children and young people today. And picking up on your point about it being depressing, it's certainly very sobering. What we didn't get a chance to talk about was the incredible resilience and survivorship that you also get an opportunity to walk alongside every day. But there is a harsh, sobering reality. You're absolutely right in those numbers. Gary, do you want to talk about contemporary children in care and
Yeah, if I can make mention, the younger survivors are more social media savvy. So we see more happening in that space. I've become addicted to TikTok over the past 2 years, which has been shocking. But we'll see more younger survivors on platforms like that. We see more questions in the New South Wales Senate about what's happening within that agency, with children, and certainly in watching some of that. I've been a sucker for Hansards and, watching political things. I've got a very boring life, but, you see some of that evidence that is presented there and you wonder, what are they doing with that evidence? What are they doing to follow up? We know there are more children going into care, Aboriginal children and non-Aboriginal children, and some of those kids end up in juvenile justice because those numbers aren't shrinking as well. So we need to do better, and we need to learn probably from some other countries on how they're doing better in that space with those kids. I went over to New Zealand for the Waitangi, one of the Waitangi repatriation agreements, and they've got an agreement over there that there is a care circle in a marae that will determine where that child goes as a Maori child. And there's the juvenile justice. Well, if their komatus, their elders, say if the kids think they're going to have it easy, they can get signed out to the marae. So they go to juvenile justice and then they go to their elders. It's their village that looks after them. It's the village that grows a child. And we need to think differently in this country. We talk about it being sobering as well, but there are some warm parts of this work. We have a methodology of engaging people and engaging communities that I've put a label on, and I call it 1, 2, 3 cup of tea. So, we have cups of tea with people, and the cup of tea equates to scoping of a space or a community, being seen in that space and being acknowledged by that space. And it's about probably after the third cup of tea where people trust us, that they can tell their story to us as well. So we use that as part of the methodology where we're engaging with communities, not just Aboriginal communities, but communities in general, and the opportunity to talk to people. So we're forming, and this is the scary part of it, but it's also the human side of our work. We're forming relationships with people so they can tell those stories.
got a few questions that have popped up? Who wants to?
We have, yeah. I've also seen that Eamon Ryan has his hand up. So I'm wondering, maybe if we don't mind, we'll go to Eamon and then we'll go to the ones in the chat, if that's okay.
Hello, Eamon.
Hi, Gary and Amanda. It's good to see you again.
Yeah,
Good to see you.
I was really interested, subsequent to our meeting last year, that Acacia and Casuarina are appearing in your top 10 type data. But I'm interested in what more can departments or facilities do to improve access to your services. It seems to be you reaching out, whereas I think the opportunity should be for the facilities to be saying to all of their people, here's an opportunity for you to contact Knowmore.
Sorry, Gary, you go.
Sorry, Amanda. That's very valid, because across some jurisdictions there's nervousness around claim farming, unscrupulous work that happens with survivors, that people will take a cut of their compensation and things like that. So we would look for general agreements, and we've gone to SCAG, the Gathering of Attorney Generals, to put legislation in place to slow down claim farming but make it illegal. But also we've talked there about the opportunity to engage with corrective services at all levels as well. It's true that it has been based at the relationship that our staff have found with certain people in those Acacia and, Serco-based prisons. It's been relationship driven. We do need some other process where the referrals will come direct to us, or we have the opportunity to be in there and do the work direct with clients. There's also the issue about there's one prison in particular that would say we can only do two appointments a week. That's all they could do, 2 appointments a week. And when you have a look at the number of clients in that facility, we're never going to get through that number of people within the time frame. I think we've mapped it about if we need to do the work that we need to do with clients at the numbers that are growing, we need to have the scheme operate until 2038.
So
2030.
and Gary, I'm just aware of some of the other questions because I can see them, so we
Right.
sort of keep moving. But Emin, we wanted to really say that part of the reason that the WA numbers are so high is because of you. So it's absolutely
Yeah,
the
thank you.
facilitation that you did. And this is what we often look for, is those jurisdictional champions who really get it and see the need. Our teams nearly killed us after we got back from WA last year because of how successful the outreach to Acacia was. But this is how this will happen. It will happen by people taking an interest and seeing the opportunity within their roles to have influence. We're always happy to take referrals, and if you contact through Gary, he can facilitate through. This is what our prisons coordination team sort of does as well. There's a question I can see on the side there, Louise. Are you happy if I just have a look at some?
Yeah, great. Thank you.
So historical groups, so that's James of historical groups. Do you think that there are particular groups that you are not hearing from? James, we would say that we still don't always hear from people with disabilities that may be more sort of challenging, I think is probably the right word to say. So we hear from people that are supported in other ways or navigate things, but people that might have more significant physical or intellectual disabilities are always harder to engage. Some members of the culturally and linguistically diverse community is also an area that we acknowledge there too. Not that we don't hear from people, but always a bit more of a challenge, and that's and when you have such a volume of people already getting to you, it's really easy to go, oh, we'll just deal with the deluge that we've got, and it's absolutely incumbent to ask that question of who are we not seeing, and then what are we doing about that. So there's a question there from Alison. What supports are available in prison to assist with these applications, and how do offenders access these, particularly in the Northern Territory? Well, we're one of them. There are also funded redress support services. If it's the Territory scheme that people in Northern Territory might also be applying for, we can assist, and there's also other services that have been funded. Happy to provide some links to that information. The issue isn't so much that there's not services. It's like Gary said, it's about getting access. And that's very much a case by case. One of the benefits we have being a legal service is that they have to let people have legal appointments. So that's some of how we work our way.
That's right.
Right.
Yeah.
I see that Peter Miller has a hand raised, and we've got time for one more question, so that might work well. If Peter, would you like to unmute?
Yeah, thanks, Louise. Thanks for a great presentation. We've been working around trauma-informed education and trying to get it in curriculums across universities. And we're actually in conversation with Deakin Law at the moment and trying to think about the way in which we can educate lawyers. I'm really inspired by some of the work in Scotland. And I just wondered if you knew of any training schemes for lawyers at either undergraduate levels or professional levels, because we're really keen to try to get the whole conversation about trauma into the public space and build more evidence like you're asking for.
Thanks, Peter. Gary, you happy for me to answer that one?
Yeah.
So, Knowmore certainly, I would say, is a national leader in that space. We have we developed trauma-informed practice, trauma-informed. We've got a whole suite, or Knowmore has a whole suite of training that it provides specifically to trauma-informed practice in legal settings.
Mm-hmm.
So how to train, lawyers in how to be trauma-aware, trauma-informed. That also includes the cultural safety aspect, around because there's an intersectionality in that too.
Yeah, sure.
There are also other groups I think that are out there, but it's a hugely important conversation, and I'm fascinated by trauma-informed education approaches. I was reading about those maybe a decade or so ago, and because they're all the dots we've got to connect, right? Like you
Yeah.
don't just start doing trauma-informed once someone's already 20 years into their trauma. We want to be talking about it from the time that it's happening.
Yeah, absolutely. That's why we're sort of passionate about it at the university level.
Yeah.
Mm.
Peter, why don't you reach out through to Gary
Yeah, for
and
sure.
then he can point you in the right direction, certainly from within at Knowmore.
You bet.
That'd be great. Yep.